I am your training system sis, Mercedes, back with more information about how to respond in a crisis situation. Today, we are going to be discussing how to respond when you may be witnessing someone choking. Before we get into how to respond to a choking individual, what exactly is the definition of choking? Choking is considered when there is something blocking the airway and a person is unable to talk, cough, or breathe consistently. So, some signs that you can look for to see that someone is choking. Universal sign all across the world for choking is someone grasping at their neck either with one hand or both hands, usually looking shocked or afraid because something's going on. Another sign would be wheezing or deep breathing as if they're trying to get something dislodged from their throat, but they're unable to get it out. There are times where you will experience people who are coughing, which is a good thing because that's the body's natural response. However, if it's profuse coughing that's lasting a while, they might be in trouble. There are other more severe symptoms, which include the discoloration of the lips and of their face, possibly turning blue or gray just due to the lack of air that is now being inhaled into the body. And sometimes people can actually pass out if they are choking and they are unable to dislodge the item from their airway. So, in this situation, you see the universal signs of choking. Maybe they're grasping at their neck, they're coughing, they're looking afraid. What do you do? Well, first things first, please get consent. I know I say this all the time, but trust me, it is very important that before you touch someone, even if it's a quick introduction, hey, my name is so-and-so, you look like you're in distress, can I help you? You want to make sure that you are getting consent. Now, specifically for choking, the person is usually responsive. That means they are alert and awake enough to be able to hear you and respond to the situation. Getting consent could be a head nod. It could be them reaching out to you, tapping on your shoulder to get help. If they're able to cough or speak a little bit, you might get them to say yes or something like that. But it is important before you put your hands on anyone who is in distress that you get consent, whether you are certified or not. You're going to start with 5 back blows. So when you are providing back blows, you want to tilt the person to 90 degrees because you want air to be able to flow up and down. Gravity is your friend, okay? So when you have the person bent at a 90-degree angle, they go from standing to a 90-degree angle with your assistance. You're going to give them back blows, again, with the heel of your hand, okay? So what that looks like, you are going to give solid back blows to the person. Now, they need to be forceful because you are attempting to dislodge something from their airway. If you are not providing enough force on your back blows, it is not going to assist in dislodging the item. After you have provided 5 solid back blows to the choking person's back, you're going to do what is called an upward thrust. It's going to look very similar to what was previously known as the Heimlich maneuver, but the Red Cross utilizes the upward thrust. So what that looks like when you are going to support the person, you are going to stand behind them and you are going to circle around and you're going to circle around their waist and you're going to find the area right above their belly button. Once you find that, you're going to make a thumbs up, turn it sideways, and thumb side is going to go into their stomach, and then you're going to cup your fist above that, or over that, excuse me. And once you are in this position, you're going to go in and up, in and up, in and up, almost as if you are rowing on a kayak or in a boat, okay? So again, thumbs up, sideways, thumb side into the stomach, tuck the finger into the stomach, free hand cup on top of that, and you're going to go in and up, in and up, in and up. And the reason you are going in the in and up motion is because you are attempting to push air up from the person in crisis, their diaphragm, to utilize that air to dislodge the item. So you're going to do 5 back blows, and then you're going to do those 5 upward thrusts. So a common question that is asked, what if someone is smaller than me, bigger than me, maybe in a wheelchair? How do I respond to those individuals? Well, there are different modifications you can do to continue to support those who are different statures when it comes to helping with a choking incident. If you are responding to someone who is larger in stature than you by height, weight, or maybe expecting and be pregnant, it is still possible to respond in a choking situation. So instead of going around their waist for upward thrust, you would go a bit higher near the bottom of the sternum and provide those upward thrusts, okay? So you would still do the same hand placement and do those upward thrusts. It would be a bit higher than what is usually done for people you can get your arms around. It is extremely important that when you are working with someone who is pregnant, that you are not putting that pressure on the baby. It is not an effective way to get the air up and out through the airways to assist in dislodging the items. If you are assisting someone who is in a wheelchair, it is still possible to deliver an effective response to a choking emergency. So no, you are not going to stand them up out of their chair. Having the capacity to hold their body weight in yours puts you at risk of falling or dropping that person. So what you are going to do for the upward thrust, you are going to get behind them as much as possible in their chair and do the same motion right there in their chair. When it comes to the back blows, you are going to lean them forward as much as possible, providing that support and giving those solid back blows to their back. So to review, when you are responding to a choking emergency, first things first, get consent. Secondly, once consent is obtained, whether from the person or the caregiver, you are going to begin with those back blows. Again, heel of your hand firm in the middle of the back. Once you have completed 5 reps of those, you are going to go into your upward thrust. Make sure that you have your wide stance. Make sure that you are putting thumb side into the person's stomach, and then you are wrapping your hand around it to provide that support and able to get that inward upward motion, okay? Then you're going to continue to do rotations of back blows to upward thrust until you start to see signs of relief from the person. It is possible to support people who are shorter in stature or bigger in stature, and those who may be in assistive equipment such as a wheelchair. Thank you so much for taking the time out to review this video and get more information about how to respond in an emergency situation. If you are interested in attending any certification courses pertaining to C.A.R.E and learning more about how to respond in emergency situations, please go to the link in my bio and it will provide you with the schedule of classes that I have coming up and the locations. Thank you so much. I'll see you next time.